Since 2011, Vidyanta has been a leading medical simulation organization. Vidyanta presents healthcare professionals the opportunity to improve their clinical competency, ensuring better patient safety and outcomes. Healthcare professionals are able to improve their delivery of patient care through our three-pronged approach. First, hands-on scenario-based simulations. Second, our blended approach. Third, our digital content. Vidyanta has been able to bridge the gap between the patient and the healthcare system to produce quality patient care and outcomes through our ability to 1. Develop content based on defined training needs, analysis for the relevant participants to ensure training offers the proper delivery of healthcare. 2. Choose an appropriate training delivery method for bridging the gap between the participants' abilities and our training methodology. 3. Evaluate competency and skills through various evaluation methods, such as ASI, to help participants understand their level of competency. Vidyanta offers the services to individuals such as nurses, doctors, nursing and medical students, and faculty and institutional clients, such as hospitals, clinics, and home health agencies, nursing institutions, pharmaceutical companies, foundations, and corporations. Simulation-based training. Simulation is needed because it is where participants can test out their skills, make mistakes, review what they do and don't, lack before, dealing with patients directly. For these experiences to be effective, being an INEXAL North India Rig Vidyanta follows INEXAL standards. The INEXAL standards is designed to be a standard for all patients and designs clinical situations according to best practices. Vidyanta offers participants access to skilled stations, patients' rooms, ICU rooms, and emergency rooms, while providing flexibility for different clinical scenarios. 4. Blended. Due to the hectic schedules of healthcare professionals, Vidyanta offers a blended model, which is divided into online theory with instructor-led sessions, which allows participants to discuss various clinical situations they face on a regular basis. Nurses are invited to attend hands-on scenario-based training sessions to enhance their clinical competency. Digital content. Vidyanta provides the opportunity to learning clinical skills through our digital clinical procedure library. For participants who are embarking into the healthcare profession, Vidyanta offers digital content, both for institutional and individual. Vidyanta provides solutions for healthcare professionals for modern clinical practices as per global standards. Our mission is to prepare clinically competent healthcare professionals through our scenario-based hands-on training, blended learning, and digital content for better patient safety and outcome all over the world. We can develop the program as per the training needs, analysis of an organization, and deliver according to the participants' competencies and generational level. To know more about us,
Contact us at